Alright, so we're looking at the rib cage anatomy. So this is kind of like an overview, like joining everything now, trying to talk about it, you know, rib cage anatomy. So you're just trying to look at this whole thing that looks like a cell, okay, which is outside and is forming a protective layer. And if you go inside, you see a lot of, different organs there. So rib cage, you should know that what they are curved bones and they form the thoracic cage. They protect vital organs like the heart, like the lungs, and they help in respiration. For you to be able to breathe in, breathe out, your rib cage has to be intact for that. So rib cage has a lot of ribs, but there's a way we classify these ribs so that we can easily study them. We have the ribs that are true. Those ones, they directly attach to the sternum. And you can see that from here to number 7. You should see that they are true. We have the false from rib 8 to 10. Those ones, they now communicate to each other and don't just give one. There are 3, but they give only one attachment, which is not true. Do you understand? Then we have the ones that don't give any attachment at all. Those ones, you see that they are floating from rib 11 to rib 12. They do not attach to the sternum at all. They are just floating. Okay, they're just beside the kidneys though. So it's a nice image trying to show the classifications that we just spoke about: the true ribs, the false ribs, and the floating ribs. You can pause to observe this picture. So general features of a rib is: a rib has a head, has a neck, has a tubercle, has a shaft, has a costal groove, and the anterior end. Okay, so those ones, don't worry, I'll have a special lecture which will go down on the general features of a rib, and for all of them, the functions are subserve. So they protect very important organs right there, like the heart, the lungs, the major vessels, and they provide some places where muscles attach, and they allow for expansion. You can be able to breathe out, you can be able to breathe in. So clinical notes is the rib cage anatomy could be affected by fractures, all those trauma directly to the chest. You can also have a flail chest where multiple fractures leading to a paradoxical chest movement. Yeah, breathing in and breathing out, but it's abnormal like that. Do you understand? So don't worry, we get to talk about all of this because we'll talk about the features and also the clinical anatomy again, where we'll bring pictures so that students can be able to visualize.